Today we are at the maternity theatre. I'll take us through a tour to the hospital maternity theatre and show you actually what entails each and every compartment that we have inside there and what the surgeons and the doctors do whenever there is any operation. So right away you'll come with me step by step. So the first thing that you have to do, remember the theatre has to be as septic as possible, so you can't enter with your normal shoes. The first thing you will do, you'll have to remove your shoes whenever you are entering the theatre. The theatre is divided into 4 major sections. That includes the preoperative area. So the preoperative area is also further divided into the receiving area, scrubbing area, changing rooms, doctors or nurses rooms, and we have the next section, that is the operative area, and the third section is the post-operative area, and we have the other sections that include the CCSD and the storeroom. So we will start with the first section of our theatre, that is the changing room. So the changing room, it is separated into male and female, just like I said, and it is equipped with bathrooms and toilets. This is the first reporting area for all theatre personnel. So anybody who works in the theatre, first of all, reports in the changing rooms. Everyone has to change and put on scrubs, gumboots, Crocs, mask, and a cap. So you can see that's the toilet, whereby if you want to relieve yourself, you relieve yourself here, and there is a shower. The pre-operative holding room. So the pre-operative holding area is used for handing over patients who are wheeled into the theatre, as well as those that are to be wheeled out of the theatre after an operation procedure. So handing over involves a variety of activities. We check if the patient consent forms have been duly filled. We also check if the pre-operative drugs have been administered. We also check if the patient's blood works have been done. And the patient blood works involve a variety of tests, such as the gross cross-match, full hemogram, and UECs have been done. And at least a unit of blood is available for transfusion. We also check if the patient has been kept nil per oral for the past 8 hours. And nil per oral actually means that the patient has not eaten anything, including water, for the past 8 hours. The next thing that we check in the preoperative area involves if the patient has been shaved and any jewelry in the patient has been removed. Things like watches, bangles, all those ones are removed before you go into the theatre. We also check if the patient vitals have been taken and the patient is stable enough and ready for surgery. So the next area that we'll actually talk about is the office, or the office is also called the doctor's room. So the doctor's room actually serves as a place whereby the doctors rest after every operation. And it is also this place that the doctors can have some tea. After every operation, this is where the doctors come and write down theatre notes, and also some theatre books. Theatre books can also be stored in this place. So the next area that we will look at is the scrubbing area. So the scrubbing area is where the theatre personnel comes and wash their hands, and after washing your hands you put on a pair of sterile gloves and a sterile gown for you to maintain a septic condition. Operating theatre. So the operating theatre is where the actual surgeries are done, and it has various equipments, but before, let us come in so that I show you how the operating room looks like. Welcome. This is the operating room, and this is where the main business of the theater takes place. So first of all, we have this heavy machine here, the anesthesia machine. So the anesthesia machine, it is what we use to numb the body. Fitted with a physiological monitor. The physiological monitor just monitors the vitals of the body. It also has these two gases used to put the patient to sleep, isoflurane and halothane. It has the ECG leads. The anesthetic rag has various drugs that are used to put the patient to sleep, and also the ones that are used to resuscitate the patient after the operation procedure. Operating bed, and it has a mattress and a marking torch. So here is where the patient lies when the operation procedure is going on. We also have a theater lamp. You can see it is movable. So this just aids in additional light for the operating personnel to be able to visualize what he or she is doing while operating. I'll put it on. So that's how it is. It is actually dimmable. You can make it brighter. That's it. The theater lamp assists. You can also move it around, just like that. Tray is where we put all the surgical tools during operation. The drip stand is just used to put some various IV fluids so that we connect it to the patient when the operation is going on. Temperatures in the theater should always be maintained. So our air conditioner is right there. So that is it. That is the air conditioner. You can add temperature depending on what you require. This is the storeroom, steel rack with various compartments, and we just store various things that we use in the operation room here. For example, this head cap here that we put on. There are surgical scrubs here. These are the non-sterile ones, and we have the ones that have been sterilized here. We also have the patient's gowns that the patient puts on during operation. We have the diethany machine that we use to cut. You can see it. And we have the surgical. So, the next part that we look at is the sluice room. So the sluice room is where all the equipment that have been used in the operating room and the operation process are brought to the sluice room. So we start with the normal procedure for decontamination that includes jig water. Then we put the equipment to the soapy water, and finally to the clean water. So after that, we come to the sterilization room. So the sterilization, as you know, it is the process of actually killing all pathogens that are in any equipment. So here we have our autoclaves. You can see the autoclaves. The autoclave is what we use to sterilize the equipment. We bring the equipment here and we autoclave them for 15 minutes at 121 atmospheres. So the next part that we have is the post-anesthesia care unit, or the PACU. So in the PACU is whereby when the patient is from the operating theater, the patient is brought and put here. Here we wait for the anesthesia to wear off. And we also monitor the patient's vital signs. We have a physiological monitor here. As you can see, there is also another physiological monitor here. So we use this machine to monitor the patient's vital signs. But in a situation whereby the patient's vital signs don't go to normal ranges, then we take the patients directly to the ICU for life support. So that was a video on a tour to the hospital maternity theatre, and thanks for staying with me. If you like the video, don't forget to hit that subscribe button and also hit that like button. You can also comment in the comment section and tell me what you think about the operating room and the operating theatre, the changing room, every compartment that we have covered. That was Homeground Medical Center Theatre.